Good day folks, my name is Emil Wirt and I'm a hepatobiliary surgeon. Your surgeon has recommended you for a laparoscopic cholecystectomy, which is the removal of the gallbladder. What does that actually mean? The gallbladder is a small organ located below the liver. Its function is to store bile, used by the intestines to digest food. Gallstones are small calcified deposits which may cause a myriad of problems in the gallbladder region. They are seldom asymptomatic, in which case they may not require any treatment. Symptomatic gallstones may present as biliary colic. Biliary colic presents as sporadic, symptomatic pain, especially in the right upper quadrant. It usually lasts for about 1 to 5 hours, but may intensify in severity. It may be a constant pain. It may not be relieved by vomiting, antacids, or passing stool or flaters. And sometimes it may be accompanied by profuse perspiration, nausea, and vomiting. It may also be non-specific, such as indigestion, dyspepsia, belching, and even bloating may be experienced. This is the most common reason for gallbladder surgery. Other reasons for removing the gallbladder may include chronic and severe infection, or seldom the growth of a tumor. Gallstones may block the bile ducts. The bile ducts connect the gallbladder to the intestines. This may warrant other specialized investigations such as endoscopic ultrasound, MRCP or ERCP if any liver function abnormalities are detected. Your surgeon believes that your medical condition and overall state of health make you a good candidate for laparoscopic gallbladder surgery. This is mostly performed through small keyhole incisions rather than larger incisions through the abdominal wall, which is called open procedures. A laparoscope, in contrast, is a narrow tube that contains a light source and a small video camera. The surgeon is able to operate by making a few small incisions through the abdominal wall. A sterile laparoscope and other instruments are inserted into the abdominal cavity by using a laparoscopic video camera. The surgeon is able to explore and inspect the interior of the abdomen, often allowing the surgeon to see with greater detail and with more clarity than with the human eye alone. It is important to understand that during the procedure, your surgical team will always be prepared to convert a laparoscopic procedure to an open procedure for safety reasons. On the day of your operation, you will be asked to put on a surgical gown. The anesthetist will discuss the need for preoperative sedation and will explain that you may expect once you arrive in the theatre complex. The procedure is performed under general anesthesia. In other words, you will be fully asleep. The scrub sister will apply an antiseptic solution to the skin around the area where the incisions will be made. A sterile drape is placed around the operative site. After allowing a few minutes for the antiseptic to take effect, a small incision is made above the umbilicus. A laparoscopic port will be placed and carbon dioxide will be inflated. 3 or more incisions will be made and care will be taken that the openings are as small as possible. Once in place, the laparoscope will provide video images that allow the surgeon to locate and pull back both the liver and the gallbladder. Next, the surgeon will remove the connective tissue in order to expose the cystic duct and cystic artery. This will lead to him obtaining the critical view of safety. Thereafter, the cystic duct and artery are clipped and divided. Finally, the gallbladder is dissected from the liver. The gallbladder is placed in a bag and removed into a laparoscopic working port where it is taken out of the body. A last check is performed to ensure that there is no bleeding, and water that was used for washing will be suctioned out at this stage. All the instruments are withdrawn. Carbon dioxide is allowed to escape through the muscle layers. The port sites are closed and skin sutures are placed. Finally, sterile dressings are applied. The dressings that I use can get wet and, if lightly dabbed, won't come off. I use a dissolvable suture which don't require removal of sutures in the future. I hope that you found the video helpful. If you have any further questions, please post it in the section below. Until next time, goodbye.